So I want to share with you what it is we do in this office to help people rejuvenate themselves, heal themselves, increase their spirit, and have a better quality of life. Because it's all about the quality of life. I think you'll agree with me. Because the reason you're meeting me right now on the website is to increase your quality of life. So let me share with you what it is we have that facilitates great outcomes. And this is our examining room, or one of our exam rooms. And this room, we're able to see how a person's nutrition is, how their health statements are, how their health is in general. We have this particular test that gives us, to tell us how their physiology is working. This is another testing unit that tells us how the mechanics of the acupuncture meridians are functioning, what organ systems are functioning, and what is needed to be corrected. In here we have a way of scanning the feet so we get to see the mechanics, because what we do in this office is we're looking at you from your nose to your toes. So to think about just a low back or a neck condition is really just a part of the story, because everything has to relate to each other. Everything has to function. An arm and shoulder have to function with the neck. So we're able to, we also have lasers in here, and we also do neurology for the brain. So we actually stimulate the brain. This is a testing environment. So for nutrition, it goes along with that particular testing. We're able to test the nutrition to see how, after we get all the readouts, whether or not those nutritional supplements or support systems are bioidentical with your physiology. So we're not looking at the book, and we're not just going to take one particular item and say that's what it is. We're going to see whether it works for you or not. We make sure that things work. We have a way of testing that. In here, many people are seeking me out for the reason of disc issues. Those disc issues are injured in some way. So what do we do with an injured disc? Well, you really can't heal a disc that well. They just don't heal that well. It's a tissue with very, very little to no blood supply to it, so it can't really regenerate. What we can do is non-surgical disc repair in such a way as to refill that disc and open up the joint so the nerves are no longer compressed. So we have various ways of doing non-surgical spinal decompression, and the tables that we use are of a particular nature that allow us to functionally move the individual however they have to move, so that we are able to unlock a story, whether we have to or not, or move it in some way so that we're able to reconfigure that structure that needs to be healed. We also do a weightless, a non-gravitational decompression. Let's go into the next room. In this room, again, we have a form of back and cervical decompression as well as functional capacity enhancement. We're able to move these tables based on the need of the patient. So we have electrostims, and you'll notice we have instruments in every room, and I'll share that with you in the next minute. We also have intersegmental traction in this room. We do acupuncture, auricular therapy. We have a myriad of items that facilitate a healing process. And that's what it's about, the healing process. In this room, we're able to work with core issues with a patient, as well as structural relationships. We have scanners in every room. And these scanners allow us to actually see what is going on with the nervous system in a person. So we do not have to x-ray a person every time they come in. They're able to be scanned and see, and so we're able to follow the work that we do as we do it. This table also allows us to adjust people without twisting them. So I can use this along with blocks without twisting. We're able to pick this up to open up a disc area. We're able to change the posture. The structure dictates function, and function is the predicate of structure. So if you have a structural relationship like this, you're going to have a blowout here. Trying to fix something while you have someone in a posture like this is an impossibility. So what we have is patients going from place to place, place to place. I want to share with you why I'm a chiropractor. I'll do that in a few minutes. Right now I'm going to talk to you about what we see here. So I look for really, really hardcore cases. If you really have a hardcore case, I am the doctor for you. And I will tell you why in just a moment. I just want to share with you, you can see this x-ray right here. This is a poor lady who had a scoliosis because of her neck. And after just a few visits, we just got her moving like this. She's now currently enjoying life. So we're able to make changes. How do I make changes? We use instruments like this, so we don't have to twist. We're able to actually take this instrument and place it on the areas of the spine to move those vertebrae. We have numerous attachments, and the reason I have so many of these instruments here is because I have the privilege of creating a whole system that is being taught all over the country, actually internationally, of the Creed neurokinetic integration technique. So I'm privileged to have created that after all these years. This is not a vibrating machine, this is a percussor. This is actually going to change the tonus of the muscle, so we rebalance the system. So what we do in this office is look at every system, whether it's soft tissue, deep tissue, superficial tissue, a nerve area, or a bone, and make those kinds of significant changes that permit a better blood flow, a better nerve flow, and a better capacity for the individual's joints to move. Makes sense, yeah? We're not going to really change too much in life. We just want it to work better. People come with a condition, and what happens is, as children, we have a very, very large adaptation world. And as we get older and injured, that adaptation world gets smaller and smaller. And then we do something that exceeds that ability, and that's where I meet you. So let's take a look. What we're looking for right now is postural relationships. So we give you a whole view of what postural relationships. This grid here helps us to determine how your structure is. So we get to take a lot of pictures to facilitate changes. Come on, let's go back here. This is your nervous system. Your nervous system runs your entire body. If there is no nerve system, if the nerve is tingling, if you've got a tingling in your arm, your hands fall to sleep, your legs go to sleep, or you get spasms or muscle spasms, it's because of the nerve. It's sort of like the electric switch. Too much burns it out, whatever the organ is. Not enough, it dies. So when we look at an organ, whether it's a muscle, which is an end organ, just like a liver is, we have to think about what is going on. So when someone comes to me and they say they have a shoulder issue, we also know that that nerve is coming from the neck into the shoulder, down into the hand. So we can take a look and say, well, let's not just look at the shoulder, let's look at where it's coming from and where it's going to. Conversely, someone may have a wrist problem that's affecting into their neck. Let's take a look at our lumbars. The lower back, we have these lumbar nerves that are coming down your leg into your feet. And as a person, and this is a conjunction of nerves that come together from your lumbar parts. It affects your bowels, the whole other part here, your digestive system is also affected. So people who are having conditions with their digestion system, we also have to look to the spine. We have to see how those nerves are functioning and whether or not the condition is because the nerve flow as opposed to the organ flow. So I'm a chiropractic doctor, certified in acupuncture, and I do a lot of different techniques and therapies to support the quality of the healing process. Now, why am I a chiropractor is a good question. I mean, you have to ask yourself, if I'm going to see somebody, why do they do what they do? So let me share with you why I became a chiropractor. I was in a car accident as a young man, and in that car accident I was killed. I didn't die. So what happened is the next 8 years I was a quasi-cripple. There were some days that I could move, but most days I couldn't. I wore a body brace from my chest all the way down here with steel rods in it to support my body, 2 canes and special shoes. But most of the time I spent in either traction, in bed, or laying on the floor, or in a hospital. I spent 2.5 years of my life in and out of hospitals. I've been to every kind of doctor, every kind of therapy, and all I can tell you is that I didn't have any good luck. What did happen was a friend of mine from the military, an Army buddy, one day carried me into a chiropractor. And 2 hours later, I walked out, carrying my braces, canes, and special shoes. Pretty spectacular, I think you'll agree. After a year of therapy with that doctor, I realized that I had another calling, that I had the privilege of having another idea of what I should do with my life. So I have devoted the last 40 years of my life to what I do here today. The privilege I have is, well, I have 5 degrees, chiropractic and acupuncture, and I have also a continuing education doctor who I give CEU credits to for continuing education. I've also written manuals for doctors of all my procedures, including the neurological support for what it is we do. And we have a series of videos. These are all for doctors to do the technique that I teach, the Creed neurokinetic integration technique. I also would like to share with you or show you, just a few months ago, the American Chiropractor did an interview with me, and I'm privileged to have been cited by them as one of their finer doctors in the country. We're getting results quickly, efficiently, and effectively. We do a lot of procedures here, and it takes time. Now, when I say it takes time, I want to share with you why it takes time. It takes time because you have to go through a healing process. However, if you put the mechanics of the body in place, you have a better opportunity getting better blood flow, better nerve flow, so that the areas can heal and support themselves, so the muscles can do their job. Remember, muscles are the motors of the body. So when you say it's just a muscle, well, that's the outcome of your nerves as well as your blood flow.